Hi, this video is about technology and what my views are on technology right now, where we are in the 21st century and in 2023, and my understanding of technology and its relevance to my life. Um, Technology and where it is now, it's allowed us to do a lot of things. And raising a daughter with disabilities, who's now 18 years old, a lot of times our family routines, it was different from families who didn't have a child with disabilities. So I purposefully, although chose to spend a lot of time with my children, it was just a personal choice for me, and in no way um, in judgment of other ways families decide to run their families. So, but part of it is probably because I had a daughter with disabilities. So, um, being in that position when the COVID-19 pandemic arrived in Fiji in 2020, that first wave, we had a lockdown for 3 months over here in where I am in Fiji, but I live in the city, in the capital city, and live in the city area, so CBD. But I appreciated the Zoom technology and what it just, how it just quickly became the platform for meetings and events. And for the first time, I was able to attend a lot of the meetings that I wanted to, but hadn't really been able to because I'm always balancing work with my daughter with disabilities. And so, and then on top of that, of course, the pandemic and the lockdown. So I really appreciated the technology, the Zoom technology. And yeah, I was able to be in the places that I wanted to be for the first time easily as a carer of a child living with disabilities. And I was really excited about it because I gave it some thought and I thought, oh, this has changed our lives, and this can change the lives of people that live with disabilities in a very profound way. And then I thought I would try to maybe do a master's on the area of uh, gender technology and disability, and had actually put in a proposal to the University of the South Pacific, and they had accepted the proposal eventually, but that goes, yeah, it goes through the university senate to be able to agree to people doing their masters. But 2021, I happened to be working, so I was working on a project, and then the pandemic lockdown happened, and wave two. And then again, the ability for us to continue working through the pandemic because of how quickly the technology responded to the pandemic, it was just, it was amazing. And I knew, oh, my life has changed. Be able to continue to work and still be a home for my daughter with disabilities, but not just that, not on a personal level. For workplaces, I think for us in Fiji, because I'm always referring to we're at different levels of development from, say, countries that have high developed infrastructure and technological infrastructure, so internet access may cost less, and technological products, laptops, mobile phones would cost less as well, but it costs more for us obviously because it has to be exported. So it'll either come across in an aeroplane or a ship, so we pay the duty on that when we are paying for our when we're buying our gadgets. But still, it allowed those who make the decisions for our organizations, the CEOs, the executive directors, the managers, it allowed them to consider that some of the job roles could be done remotely, and so we hadn't reached that stage yet. Although I know in countries in the more developed countries with more developed infrastructure and technology, it was already happening, and in certain fields, people were able to work remotely from like their headquarters. So when the pandemic happened, we were forced to work at home, and so the thinking as a result and the way work practices have blended and changed a little bit since then. So it was one of the developments of technology that changed for the better a lot of our work-life balance. And then for people with disabilities, I think it just changes their lives in a big way because of the access issues, getting to a place physically and costing less. So it was like a dream come true, and I was really happy about it. And then now technology, because of the digitization and where it is now, costs are also much lower too. It's affordable. Um, I don't know what's the recent statistic, but a lot more people have mobile phones now than when it came out. I remember the first mobile phones here in Fiji were sold in around 1993 in the over here the early models that had a little antenna and looked more like a walkie-talkie. But yeah, but it's more affordable now, and most people uh, above 18 own mobile phones. um, the other thing with technology, I wanted to comment on the digital world and the digital world that we're able to live in now. Um, Last year, I saw an article on an anthropological analysis on the digital world or digital culture, and I thought, oh, that's really interesting. Um, and then the digital nomads. So nomads, like in the physical sense, are just wandering around, don't really belong to any country or place, and so there's this digital nomads who travel for different reasons, probably work or leisure or a mixture of both, and taking photographs and putting it on the internet and having friends and family in the digital world and the digital culture that's evolving. And then now in the media is all over the media lately is the metaverse. Mark Zuckerberg's new concept coming under the Meta brand that used to be Facebook and the other companies, that's rebranded and coming under the Meta brand. And it's really interesting, I thought, because metaverse, the technology, the way they're talking about it, is going to change our workplaces again. And I thought, oh, I was just still happy about Zoom technology and being able to attend the meetings. And now Metaverse is one step ahead again. So using the gaming technology or evolving from the gaming technology, when you switch on your computer to attend a meeting, you're actually like in a virtual meeting room. And I thought, oh, this is just really amazing, because then it changes not only creativity but I think, yeah, it's just experiences that would make work maybe easier. Because one thing with Zoom technology, uh, when you're working at a desk, a lot of work you can do on your own at a desk, but then you still need to be talking with your colleagues, and you're having the meetings with your managers and directors, and that's important part of the work. So you're working as a part of the team, so you can do that in Zoom, and we were able to do it successfully. uh, I worked under a manager, Christina Gill, and we were able to do that under her leadership. But yeah, I thought if it's metaverse and actually being virtual in the virtual office, that's just another level. And this makes, I think, working more uh, in remotely more um, seem more realistic or exciting. But yeah, part of quality of life experiences looks like going to be involving being in virtual realities. So I thought, oh, it's really interesting. Um, But on the medical side, I really value how technology is today, because same with the technology where it is now, and that same metaverse, virtual reality technology. Um, I watched a documentary where there was a surgeon who was doing surgery, carrying out surgery using the technology, and he was saying how surgery will now be more accurate due to being able to see more clearly, and yeah, the procedures that he's carrying out. So it's a good thing. And with the COVID 19, also, when it came out in 2020, we were in lockdown for 3 months. And then most of us knew, if we were following the news, we knew, oh, this is not the last of it. Um, it's probably going to come back. And then it did. So, and the second wave. But then we were all told to stay indoors, and we stayed indoors because there wasn't enough information. So because of that, we have to err on the safe side, and all the authorities were advising us to stay indoors because we didn't have enough information of what was going on, and so we did that. But within 1 year, the vaccination had been rolled out across the world, and that was amazing as well, because, and I thought, no, that they did that, able to do it very quickly because of technology, because they had all the medical personnel and professionals and the policy people and all the people across the board, down to the ambulance and nurses, hospital staff, and then they sending the vaccinations in the aeroplanes, and the aeroplanes, the airport, and all that, and how they were able to come up with vaccination and then roll it out around the world in 1 year. And I thought that was because of the technology, and we were able to watch what was happening and getting official updates on TV and on radio. It was coming daily from our over here in Fiji. It was the permanent secretary for health, so it was Dr. Fong, is his name. So that's quite it's reassuring when you're having like a government official giving you updates every day. So that was reassuring. You could switch on the radio, listen to it at the hourly news, and then switch it off again. Because at the time, I know a lot of parents are starting to just be a bit wary about not having our children overloaded with, just not to worry them, not to concern them, because there was a lot of news coming out. And so, yeah, it was to leave the radio mostly switched off and only switch it on. After a few months, we just learned to do that, just switch it on to hear the latest news and official news. And because there were all sorts of other news, of course, going around. The social media, does it. People say they had cures, but that was because of technology, and That's what I thought. Like the world, we're always going to have these breakouts, these pandemics. We've had it in history before. It was nothing new. Nobody's fault. I don't think so. Like we had measles, we had leprosy, we had tuberculosis, the mumps, and AIDS and SARS, the bird flu, swine flu, those zoonotic diseases, leptospirosis, and that's the condition of the world. And I don't want to join the two sentences, but the human condition, I think, also it involves weaknesses in these vulnerabilities. You can get sick. There, even living with disabilities in Fiji, the percentage is about 20%, or 15 to 20% of the population live with disabilities. So that means it's affecting 15 to 20%, not just individuals but their families. And this statistic is generally the same for countries around the world. So that's part of the human condition, and it's not anything separate. So I was really awed by how fast the technology was able to adapt to the needs our time. And I appreciate it. And I really think that the children, the young people of today, are really fortunate to have all the information and access to creativity, education at their fingertips daily. All right, then. Thanks for listening. Bye.